I'm thrilled to be back with you for such a highly anticipated show. This one has been in the works for what feels like forever, waiting for the perfect moment to come to life. Well, that moment is here, and I'm excited to introduce season 3, series 2, titled Ageless Intimacy, Real Talk for Women 40 Plus. In this series, we're diving into the evolving landscape of women's health, specifically focusing on the changes in sexual and reproductive health for those 40 years young and beyond. This conversation is for the seasoned women out there with a little extra life experience, and for the people who love them or will one day be them. Yep, we're looking out for our partners and the younger ladies seeking wisdom as they prepare to embrace this next phase of life. As young girls transition into tweens and teens, we learn about the miraculous changes our bodies undergo with menstruation. Some of us become mothers along the way, and if we're fortunate enough to reach 40, we face another significant change: menopause. Some of us eagerly anticipate it, ready to say goodbye to the monthly reminders of our fertility. Others might fear it because they don't know what to expect. I mean, sure, we've seen our mothers, grandmothers, aunts, friends, and coworkers go through mood swings, hot flashes, and maybe we've heard whispers about vaginal dryness, incontinence, and other unpleasantries. But let's be real. How many of us have had the chance to sit down with a health professional trained in this area to get our questions answered? Well, let me lay down some foundational information to set the stage for this discussion. As women age, our hormones change, directly impacting our reproductive system. Perimenopause is the stage before menopause, which might start several years before you actually enter menopause. Just like when your period started, there's no set age, date, or time to predict when a woman will either enter perimenopause or menopause. The primary sign is that a woman's hormone levels and reproductive system are beginning to change is when she experiences dramatic changes in the frequency, duration, or amount of her menstrual cycle. It's not just your ovaries and uterus that start behaving differently. You might also experience hot flashes, night sweats, swollen and tender breasts, dry skin, fuzzy thoughts, less libido, mood changes, and yes, you guessed it, weight gain. I mean, ladies, can we ever catch a break with this weight gain thing? But that's a topic for another episode. You'll know perimenopause is over and menopause has begun once your period has stopped for a full year. I'm thinking Shangri-La over here. But as they say, more blessings, more problems. The devil is busy, y'all, I'm telling you. Once menopause hits, your body stops producing estrogen and progesterone. For those of us who are hormone receptor positive breast cancer survivors and fighters, this is the goal and key to survival in many cases. But I digress. When your body stops making estrogen and progesterone, your ovaries stop releasing eggs, and you can no longer become pregnant. Freedom! In my Beyonce voice. Just kidding. Sort of. But now your vagina starts to change. It can become dry. The skin of your vaginal walls become thinner, and you're more prone to experiencing painful sex and yeast infections. The devil is a lie. Oh, Lord. But yes, menopause is real. The good news is that there are ways to ease these natural life changes and experience ageless intimacy. The upcoming episodes of this series are packed with real talk for women 40 plus. Thanks to our expert guests, we'll delve into the socio-cultural aspects that often prevent women and men from understanding the natural changes we'll all face if we're lucky enough to do what the old folks say, keep living. We'll also tackle the political and industry factors that can either support or hinder the health and well-being of women over 40. Plus, we'll hear from you as we discuss the results of a survey that over 74 women participated in over the course of just 12 days. While reviewing these results with my guests, we'll uncover some aha moments, predictable trends, surprises, and concerns. But most importantly, will share reputable sources you can access to help you and your loved ones live your best lives, sexually, relationally, and personally at 40 and beyond. It is my pleasure to welcome and introduce Dr. Gail Wyatt. Thank you so much for joining us today, Dr. Wyatt. I want to let our audience know about who you are and why it is so wonderful to have you to be a part of this show. Such an honor. Dr. Wyatt has been awarded the Dina Bat Yaakov Endowed Chair in Psychiatry. A clinical psychologist and licensed sex therapist, Dr. Wyatt is a distinguished professor of psychiatry and biobehavioral sciences at the Simmel Institute of Neuroscience and Behavior at the David Geffen School of Medicine, and the first African American psychologist at the DGSOM to be so awarded. Dr. Wyatt's focus over 48 years has been on health disparities. Alliance and Pepperdine Universities, respectively, have awarded her honorary doctorates for her community based research that has generated over 250 publications and 6 books thus far. She was the first person of color to receive the prestigious NIH Research Scientist Career Development Award for 17 years and developed methodologies to capture the cultural context of stress and oppression overlooked in clinical research that contribute to misdiagnoses among people of color. She was the first African American to receive a license to practice psychology in California. She founded and directed the Center for Culture, Trauma, and Mental Health Disparities and the Sexual Health Programs for 16 years. Served as one of the associate directors of the UCLA AIDS Institute for over 2 decades, and has received continuous funding from NIH, private foundations, and state organizations since 1980. Her landmark research chronicled the prevalence of sexual abuse among African American men and women, with her findings helped to extend the reporting limitations of abuse and violence that has facilitated survivors to disclose their past abuse. Dr. Wyatt has provided congressional testimony 10 times, and of those testimonies, 2 were before then Senator Joseph Biden at the Violence Against Women hearings. Dr. Wyatt wrote Stolen Women, Reclaiming Our Sexuality, Taking Back Our Lives by Wiley and Sons, which is a bestseller that details the effects of slavery and oppression on African American women today, based on 20 years of her research. Dr. Wyatt has had domestic and international training and research grants that have resulted in her mentoring hundreds of men and women in Jamaica, India, East Africa, and South Africa, where her team continues to train scholars in trauma and mental health effects. She has been instrumental in leading NIH funded research teams of color since the 1990s. She is a well known speaker. She has given community level and professional presentations in every medium, including on Oprah Winfrey's Speak Sis series about Black women's mental health. Dr. Wyatt has received numerous awards for her work in diversity, inclusion, and trauma risk for people of color at risk for or living with HIV. This overdue recognition could have not been possible without the creation of a close and supportive network of family, friends, and resilience to match that of her ancestors. She has been married to Dr. Lewis Wyatt for 56 years, has a son, a plastic surgeon and graduate of UCLA Medical School, 2 granddaughters, and a daughter who was also a UCLA Medical School grad and is now an angel. God bless. Thank you so much, Dr. Wyatt.
It's delightful to be here.
Yes, I am so thankful to have you here. And I will have to say, I have bore witness to Dr. Wyatt multiple times, including in front of a congressional briefing. And so I am so glad that she is here. Our other guest for today she goes by Jen, but her name is Jennifer Thornton Jones, and she has been a very, very important and inspiring person in my life and in my health journey. Jennifer Thornton Jones, She is a PT, among other things, a senior physical therapist, board certified in both women's pelvic health and oncologic physical therapy specialties. She is a co coordinator and mentor for the Women's Health Physical Therapy Residency Program and a clinical educator for the Duke University DPT program. Her areas of practice include pelvic floor dysfunction, pregnancy and postpartum care, lymphedema and cancer rehabilitation, and sexual health. She participates in specialty projects at Duke Health System, including a task force to improve perinatal care, and is the lead physical therapist for the sexual health clinic at Duke Women's Cancer Care, Raleigh. She serves as a peer reviewer of the Journal of Women's and Pelvic Health Physical Therapy. She comes to us with an enormous amount of passion, enormous amount of education and expertise, as well as resources. So hold on to your hats. We're in for a great conversation. Thank you so much for being here, Jen.
Thank you so much for having me. I am absolutely honored to be here, especially with Dr. Wyatt. This is just, I've been so excited about this conversation all week.
So have I.
That's great. That's great. So now we're going to jump right in by talking about something called life course, right? For those of us who are involved in areas of expertise around public health, health behaviors, different types of social sciences, we learn about this term called life course. And we're going to talk a little bit more and dive into that and hear from our experts about what does life course mean and how does it relate to the changes that women's bodies go through over their course of life, right? That also means that as our bodies are changing over our life course, that also affects our sexual and reproductive health. So we're going to jump right into that. And who would like to start us off with their just impression of life course and how it affects women over, as it relates to sexual and reproductive health?
Well, I'll start, and then I'd love to hear what Jen has to say. The life course is really an important concept that more typically describes what it is that we do as behavioral scientists, as clinicians, as therapists, as advocates, as citizens and individuals. We have been in the past used to only hearing about findings as if they were permanent and static. And now we're beginning to accept the fact that people change on a daily basis. Some people change within a day, depending on weather, health, hormones, and you name it. And it really presents a different challenge for us. And I'm glad we're going to discuss it today, because everything that we say has to look at life course and take that into consideration. There's nothing about our bodies that is permanent, except probably the fact that if we're alive, we will continue to breathe and process all of the things that go along within us and without us. But otherwise, everything that we are learning in science, and I do believe in science on this topic, has to be muted by the fact that it may be that way today, but it won't necessarily be that way next year or in 6 months or tomorrow. So it really makes us more humble in what we tell people that we think we know. And it makes us as professionals more humble in what information we provide. People need to challenge health professionals about how they're answering. What kind of information are they providing? Is this something they should be concerned about forever? Or is it something they should be concerned about within this age range or under this circumstance?
So I hear you saying humility and being open and remaining curious. That's something that I always say about what attracts me to behavioral science. I'm always very interested in people and all the different forms and shapes that we take and experiences that we have. And I think some of the best scientists are those that remain curious, those that are able to really create innovations and reach people in a way that's meaningful, are those who remain humble and understand that, we change over time, and our knowledge changes over time. And if we're open, we can change with it. So I really appreciate that.
Mm-hmm.
Jen, where do you come into this conversation on life course?
Yeah. So I think, especially based on some of your survey results, I'd love to give a little context for what I'm going to say, because there was about 75% of women who didn't know what pelvic health physical therapy was.
Mm-hmm.
So to
Yes.
give context about me and my specialty and the work that we do, a pelvic health physical therapist is a physical therapist who specializes in the neuromusculoskeletal health of people with pelvises, which is everyone. So traditionally, our specialty section was called women's health. And this actually came about historically because before it was women's health, it was obstetric and gynecological health.
Mm-hmm.
So as we have learned more and as we have broadened our treatment, we're broadening the name. So now it's the section of pelvic health, because we also treat women, we treat children. But narrowing it down more to the biologically female pelvis, what we are looking at is really the health of this person as they develop throughout really their kind of like preteen to teen to early womanhood, peri and postnatal, if that's part of that person's journey, menopause, perimenopause, and beyond. And so when we're thinking about the impacts of everything that someone is going through on the health of their neuromusculoskeletal body, there's quite a broad range of things that can impact a biological woman specifically. And so when we're thinking about that, and we're thinking about all of the things that Dr. Wyatt mentioned, there is so much room for different inputs that can change what is happening for our body throughout this time, apart from just growing, right? And so really a big part of what I see is that is your body is also changing throughout all of these times. And just in the way that Dr. Wyatt was saying, like as a person, you are changing and you're going to be a different person when you're 20 to a different person than when you're 40 to a different person than when you're 60. Very thankfully, I would say. For at least on my part. We're also having a different experience in our physical body. And we also have a different relationship with our body at these different time periods, and different things are going to be impacting our body throughout that time. And so when I think of that, I'm thinking of what is a person doing in their physical body? What is their relationship to their physical body? What are their goals for how they want to use their body throughout those different stages? And so that's what a sort of women's and pelvic health specialist does, is look at the different things that are impacting that patient's neuromusculoskeletal body throughout that time.
I love that answer. And I love the fact that both of these answers touch on different aspects of what life course is about and how it's approached. I've got two questions for you, Jen, just from that wonderful response. What do you mean when you say neuromusculoskeletal? Right? Can you break that down for us?
I can't. So I want to emphasize that because I think that a lot of people, when they think of a physical therapist, think of, you know, someone who might help them if they have knee pain, or someone who might help them if they have a shoulder surgery. And for a lot of my patients, even the ones who are referred to me, by the time they get to me, most people are like, I mean, I don't really know why I'm here to see a physical therapist. Like, what can you do? So I tell people, first of all, I am an orthopedic physical therapist. I treat the musculoskeletal body. I just do it in a warm, dark place for most people to let me access some of the aspects of your pelvis. I really emphasize the neuro part, especially for our talk today when we come to sexual health, because there is a huge component of what our brain and our spinal cord and our peripheral nerves, all of those things, there's a huge component of that impact of that system on what your musculoskeletal body is also doing as well. And especially with sexual health. And Dr. Wyatt is, I would not in any way want to overstep any of her expertise. So I think for a lot of the answers, I'm definitely going to defer to her first, because when it comes to sexual health, I am very much there as a pelvic therapist to talk about tissue changes and muscular changes and a lot of the physical impacts on our sexual health.
Mm-hmm.
However, I can talk about that stuff until I'm blue in the face unless we address the neural part, which is your brain, the most important sexual organ. And so that's why I really want to emphasize that neuro part is for a lot of us in physical therapy, not just in sexual pain, but in all types of pain. We are starting, especially since like the 90s, we're really starting to grow in the amount that we're realizing that we have to put on pain science and the neural component of what's going on in your physical body, which you think of a little bit more as that like musculoskeletal part.
And you know, Jen, this really brings up the issue of women and the stereotypes that so many people have and perpetuate to this day about sexuality and what is sexy and how do certain women express their sexuality that seems so inviting and enticing to so many people in the world. And I've often said that the brain is the sexiest part of your body. And it's ironic that when you see tires being sold, engines, trucks, you name it, there's always a woman in a bikini or a, you know, something scampy, not a lot of clothes on her, in other words. And it's as if her body is the instrument of pleasure for somebody else, not for her necessarily, but it's for somebody else. And that will entice you to not only want her, but you'd want whatever she's standing in front of or selling beside her body. And that's just not true. I mean, if people really understood the body and the brain, they'd know that that kind of approach is an absolute turnoff. I'd say for about 90 to 95% of women, if you come at them remarking about their breasts or their behinds or anything having to do with their physicality, they are done with you. They don't want you because all you're looking at is what is very apparent. The more sexy a person is, the more interesting they are. What kind of conversations they can have? What kind of interests do you share? That's the ingredient of a really safe and inviting relationship that you may want to explore. And so what I tell women is before you even look at a partner, you've got to find out what is it that you want in this partner and what is it that you're willing to provide or to give. And the first thing you need to do is work on yourself. If you're not interesting, if you don't have good brain health, if you don't take very good care of your body, what kind of partner are you really going to be for someone else? And that just changes therapy because that's really where it begins in therapy is everyone has to, at some point, you know, accept the fact that life pretty much is going to be what you make it. And it's going to be pretty much what you make it with communication with your partner. So your health and all the things that you can provide have to begin with that neuro beginning, that brain health.
And see, this is the reason why I love having people who specialize in mental health, psychology, and then pairing them with people who specialize in physical health. And especially when those two professionals are geared toward the intersection of both, right? Yes. And so that's the beauty of this discussion today. And our two guests here is that they are able to make that mind-body connection as it relates to our changing bodies, our sexual and reproductive health. And one of the things that you mentioned, well, both of you mentioned, is that, you know, the whole thing about we're changing, right? And we're changing over time. And what came to me as Dr. Wyatt was talking is that what you want and what you're looking for in a partner, whether it's short or long term, changes with age, right? Yes. So the mental aspect of even your own clarity, right? It changes with age. What I like to say, wisdom, right? And then in addition to that, what your body can do and not do changes over time. Can we talk a little bit more about what are the things that we're looking for that changes generally, right? And then also, once we find that person and we're 40 plus, what are some of the differences in our body about how we, and not everybody, but just some common things about how we approach sex, how we enjoy sex, the things that help to allow our bodies to receive that person in a healthy way. And even maybe some of the things we need to be thinking about as it relates to sexual health around the STI spectrum. So I know I packed a lot in there, but I hope that you're picking up what I'm putting down, if you get what I'm saying.
Well, according to what I hear, and this is what I read and what I hear from clients, is that if we're talking about women, most women want an attractive person who has some of the status of people who are successful. They don't want a loser. They don't want someone who looks like they need to be taken care of. They don't want to be their person's mother. They want to be that person's partner. They want to be taken care of, swept off their feet. Now, this is where fantasy really comes in. So as a sex therapist, fantasy is as an important a piece in sex therapy as when you're a little girl or a little boy and someone's reading to you. Your fantasies, what is it you expect? What have you always dreamt of? And for women, remarkably, no matter how old they are, they still want to be swept away. Which means you don't have to think. All you have to do is feel, and that someone is so powerful and so and has such mastery that they can simply know what you need, provide it for you in a safe environment, and that you're going to be happy with whatever it is that they provide. I rarely hear anyone say my fantasy is to do that for somebody else. It's usually what I want for me. That's the base, what I call the base fantasy. And that creates a horse, someone on it riding, and it's just that old to swoop them up. The issue of safety, you hear, but there's no discussion of, well, how do you determine what is safe? You're letting the person make all those decisions. At what point do you if you're breaking into a fantasy? And I start there because that's where most people are. They have expectations of what they want, and they're usually very disappointed because whatever it is they're doing or whoever it is they have in their life, they're not meeting those needs. So the first thing is to talk about what is it you expect. And usually safety's not established. And that's the one thing, if they leave my office, they've got to know how to establish. It's how to be safe. And safety means nobody is going to hurt you. You're not even going to hurt yourself, but nobody is going to hurt you. That means they cannot make all the decisions for you. You know what you need. You know your body, or should know your body. And that part of the communication has to include a conversation, not someone swooping you, but actually sitting down and saying, now, what is it you like to do? And what I like to do, and making the decision from there. What can you do? What will you do? Because what can you do does not mean what will you do. Just because you can do something doesn't mean you should do it or you like to do it. And there should always be an interaction. If sex is going to be involved, where everyone's doing what they want to do, what's healthy, what's safe for them to do. So this is far more complicated than what you see in the movies or you read in books. It's really a business proposition. What do you think, Jen? Do you see it that way?
Yes. I think the two pieces that I would love to add on to there are safe. Well, sorry, three. I could keep going, but let's focus. Three. So safety, communication, and knowing your own body. And I do not know if you wanted me to start with like any of the political stuff, but let's just be real here. Being a woman is political.
We can't avoid it.
We can't avoid it. Being a woman alive in this society is political. Sex is political. Yes. So as a woman, and I want to be, I'm going to say as cis or trans or non-binary, anyone who's not a biological male, let's say, or anyone who's not biological, I don't think that we are taught to learn safety in our bodies, how to communicate about our bodies, or how to communicate sexual desire.
Right.
We're actually taught the opposite.
Right.
And we are not taught how to have a relationship with our bodies. And again, actively discouraged often from having a sexual relationship from our bodies.
Yep, I agree.
And so when you're talking about the most basic pieces of this, these are things that most people struggle with, even to wrap their head around having the conversation.
Yes.
So I think from my perspective, a lot of the times, sometimes the first session for me meeting a patient is even introducing the idea to them that these are concepts that are important for them to hold space for at all.
Right.
And that can be very difficult. That can be very difficult because regardless of, I think, culture, if you want to just restrict it to like Western North American culture, all of us as women have been told a certain thing about what all of that is supposed to look like, that safety, that body autonomy, that sexuality. We have been told something from multiple sources that is not true. And so that's a lot to digest when you might be coming in and just saying to me, you know, I'd like to have better sex with my partner. It's like, wait a sec, which I think you mentioned that you kind of had that experience when you were talking to people. And then let's even take it out of that as well. From a more medicalized version, I do think that for a lot of medical providers, it takes a more active provider to really understand a lot of that. And so a lot of women have also been dismissed even when they did find their voice to discuss these things in the past.
Yes. They don't know who to talk to about it because medical professionals are well socialized in the world we all live in.
Yes, Lord.
Talk about it. I teach in a medical school. They don't learn how to talk to people about sex, not really.
No.
And to separate their own experience from what they're hearing, that their patients need. Usually whatever they were taught, they feel like the whole world needs to learn just that.
I think that takes a level of self-awareness that is hard to digest when you're also trying to get up the confidence to become a doctor.
Right.
Or other type of medical provider,
in itself is a whole thing. And then, yeah. Okay.
So I think, when we're talking about even starting to wrap your head around these concepts and what they mean for you, there's a lot to even digest at the start. And I do also want to emphasize for anyone listening who is just starting on this journey is it sometimes brings up a lot of like intense feelings because it's a vulnerable topic. And I think that any of us who get to a certain stage of adulthood have a certain amount of trauma around it, whether you've actually had any sort of like physical or sexual trauma. We have trauma from the lies really that we've been told throughout our lives.
Right. And especially when people realize that they're supposed to communicate about sex. That's a mind blower that men who've been married for decades talk about the fact that you're supposed to say something. You're supposed to guide your partner. How could your partner possibly know what you need today? It isn't what you necessarily needed yesterday.
Yes.
Or tomorrow. It has to do with how you're feeling, what's been said during the day, how you've been treated. All of these things you bring into a sexual relationship. It's like your whole day, your whole world comes to bed with you. And this is particularly unique for women. It's unique for men too, but we can talk about that in a minute. But for women, it's not just do you want to have sex? It's like gathering all that's gone on with you. Can you give something to me today that would be sexual? Do you want to do that? And it could be, I'd like to, but no. And your body may be speaking to you by, you're not aroused. There's nothing about you that says you're ready for sex. You're not breathing hard. You're not perspiring. You're not breathing in a shallow way, not deep breathing, which is for relaxation, but shallow breathing, fast paced breathing, nothing. Your nipples aren't hard. You're not lubricated. There's no warmth or kind of warm liquid that's maybe somewhere around your vagina. Nothing is happening for you, but you're saying, yeah, I'll have sex with you. Really have to ask that person, why aren't you communicating based on what your body's telling you? What you really are feeling right now? What's wrong? What's holding you up? And most partners don't ask. They want what they want.
Or they take it personal when she's not having those physical readiness signals, right? So that happens as well, to bring in, the partner in that aspect, whether it's another woman, whether it's another man, what have you. Some people often take that personal. And I think that goes back to what our culture and society has taught us about what sex and sexuality is, and how that ties to our identity as being feminine, masculine, attractive, what have you.
Yeah, absolutely. I think a huge conversation that I have with a lot of patients is around lubrication and using a lubricant. And that brings up so much stuff for the person and for their partner, because again, it's why do I need this? Why do I need to supplement with this? And then for the partner, it's why do you need this? Like, why do you need more than what I'm doing or giving to you?
Or what you're doing, yeah.
And that sort of clash, I guess, between what the lubricant is actually trying to do for you physically and mentally, how you're perceiving it, can be a thing that we kind of have to get over a little bit. And I think especially when we're talking about women who are in a postmenopausal state or even going through perimenopause. So first of all, let me just go out and say, lube is fabulous. It's for everyone. Everyone should use lube. It's wonderful stuff. Right. There are ways of incorporating it into sex that can be really fun and sexy. But I think especially if you're a woman who is in a state where we are getting changes to that hormonal levels that are causing vaginal dryness, lubrication is essential. And I think that as we talk about how people relate to their changing bodies, realizing that arousal response that Dr. Weil was talking about is going to change. The physical arousal response is going to change as well. So it doesn't necessarily mean that there's a huge problem. It just means that there's a different way that your body actually shows its arousal now, which might mean there are different tools you might use to get a similar or different or better effect, same effect. But it's just about understanding how to use those things, and again, understanding what your body's doing so that you can avail of those tools that are out there.
I deal with a lot of people who very much live their own culture. They are what I call, they know how to code switch. They have behaviors and clothes and friends that meet the larger society of, getting along and doing a job that they can do very well. But in their own personal lives, they live within a cultural context. The things that they were taught by their parents, the things that they share with their ethnic, religious, gender-based friends, are the things that really warm them and help them, guide them through life. And amongst people of African descent, skin to skin is a concept. And I'm sure it also exists in other cultures. But the whole concept of when you have sex with somebody, it has to be skin to skin. That means you have nothing on, and you have nothing on your genitals, and you use nothing on your genitals. Because real sex is just me and you, like we were just born, like Adam and Eve kind of sex. And that is just so far away from reality. And when I said that sex is a business um, communication, I meant it. You have to understand that not only do we change every day, the world changes. And the world just got infected with COVID.
Mm.
We all now know, I hope, that there are viruses that pass through people, large numbers of people over time, and then they can die off and then reemerge in a slightly different variant and wipe us out again. And that this is something that at one point, I guess we thought we had conquered as a civilized people, but we haven't. And nor have we been careful enough to prevent these viruses that we have no real medications for from spreading. So we just saw what can happen when a group of people, like in the Western world, they're supposed to be well educated, conquer a virus. They didn't. Some people never accepted the fact that there was a virus. Some people never accepted the fact that you needed to wear a mask to prevent it from spreading to someone else. They mistook it from a freedom to express yourself or freedom to do what you want to do in the world. It has nothing to do with public health, which is you protect yourself from things that might infect you or affect you. So I'm using viruses as a way of getting back to sex. We didn't even get it. And even though the information was there for a lot of people, not everybody, but a lot of people, that viruses need to motivate us to change our behavior. Even when you have infections that you can get during sex, people are not convinced that you need to do anything about it. Still, that if you don't want to have children, you just don't have sex. Or you tell your partner to pull out. This is one of the oldest methods still people use. Withdrawal, as if that has anything to do with preventing yourself from disease transmission or pregnancy. So we're still operating with people who just won't let some of these things go because culturally, that's what they were told. That the best thing you can do is just present yourself and let things fall as they may. Well, things aren't falling well. Comes
100%
to a whole lot of people. And our society, and I will say it, Jen, our political climate is a large number of people are committed to taking away whatever knowledge, whatever self-empowerment we have as women, to the point where we're back to just presenting ourselves. That's really the way we ought to operate. Therefore, there will always be more people pregnant than want to be, need to be, can't afford to be. And whatever happens to those poor children is just, too bad. They'll end up in jail or in an orphanage or whatever. The point is, that's the way sex ought to be. And now that was done for 250 years in this culture, if we didn't know it, to African descendant women who were enslaved. And we are still suffering from the effects of that experience, not being able to control our bodies today. And now it's out for everybody, every woman, every child, every girl. So when you talk about sex therapy and what we can do, I mean, the responsibility as a professional is huge. Where do you begin? Because you not only have to deal with what people are learning about sex, they really shouldn't know anything. Taking all the sex education that really just presents the facts out of school to abstinence. Just don't use anything, don't do anything, and don't use anything. So we have to see this as a political issue. We have no choice.
Thank you for joining us on Questions You Didn't Ask with me, Naisha Frey, and my guests, Jennifer Thornton Jones and Dr. Gail Wyatt. Tune in next week as we continue our series, Ageless Intimacy, Real Talk for Women 40 Plus.